If you're sick and tired of being tight, stiff, and sore, and I know I was in my mid to late 40s, I was just incredibly tight. I was incredibly stiff, and I just pretty much had to quit doing the physical massage therapy work that I was doing. So if you're sick and tired of being that tight, that stiff, and that sore, then this is the place for you. And that's the purpose. That's why we do this. And that's why we created the Purposeful Foam Rolling, because we want to teach you how to use these tools so that you can be flexible, mobile, less painful in your body, so that you can get out and do the things you want to do. So today we're going to be talking about a muscle that I had a client, and she was getting pain down the side of her leg. And in fact, some of the people thought it was bursitis. Some thought it was the IT band. She was foam rolling the IT band. She was trying to take care of what needed to be done as far as bursitis, and it just wouldn't go away. Well, it turns out it wasn't this side of the leg. It was really this muscle right up here. This is half of Mr. Manny here. And we're going to be talking about this muscle right up here. This muscle is called the tensor fasciae latae, and it is a muscle in the side of your hip, right up here. And it is the muscle that actually attaches to your IT band. So we're going to talk all about that. So let's start off with the location of this muscle. So it's comes right off the top of where the front part of your hip is, and drops down and attaches into the large IT band, or the iliotibial tract down your leg, okay? So most people know where the IT band is. What they don't know is that there's a muscle up here that attaches to it. So to find this on yourself, basically, let's see here, we'll bring this up. Actually, I want to bring it down so you can see my hip here. So it's going to be right here. Do you see my pocket here in my pants? That's the location roughly of where this muscle is at. So there's a bone right here. So if I put my hand on my hip, I'll feel this bone right here. This is basically where this muscle is attaching to. And it basically runs right down where my pocket is, and then attaches into that IT band that goes down the leg. So right here is where it's located at. In fact, if you put your fingers right there and just move your leg around, you'll feel that muscle move in there. And that's your TFL. That's the nickname. It's a lot easier to say TFL than it is to say the whole name of the muscle. So we use the word TFL. But that's how you locate it on yourself. Okay? Now, what does this muscle do? Well, it helps, or it assists in bringing the leg forward when you're walking or running. So after the leg has gone back, and we call it the swing phase, when the leg is swinging forward, this muscle is helping you do that. It's assisting other muscles to do that. It's actually helping to rotate the hip inward, so pulling the hip inward. And it helps to move the hip outward. So as this whole area can actually help the leg move outward a bit. And it also stabilizes the knee right here. So it's providing a lot of work for the hip and the leg. Now, what happened with this lady that we were talking about, my client, she had a trigger point right up here. And the main focus, I think, for a lot of people is the area that most people know, which is your IT band, which is this big, large fascia tendinous material that runs down the side of your leg. And it's painful when you foam roll it, so most people think, oh my goodness, it's always tight, it's always tight. And we don't want this tendon to be tight, but a lot of times it's not necessarily the muscle that's causing, or I'm sorry, the tendon, this tendinous fascial thing here, it's this muscle up here. And so people tend to focus here with the foam rolling, but they don't get up higher into the hip because they just don't realize that this tendon has to go somewhere. This iliotibial tract has to come up to something, and that's the muscle right up here. So that's what she was missing. So the trigger point she had was, and this muscle is a very common one, right there. And that's, do you see that mark there? Let's see. Let's bring that up just a little bit there. And we'll bring that over a little bit there. There we go. And we should be able to see that little mark there. That was the trigger point. And that trigger point can cause pain pretty much in this area right here, which is where she was having problems. So you would think she was having IT band problems because this is where her pain was at. and that pain can really be, it can prevent you from walking quickly or even running. It can really wreak havoc when you're laying on your side, can make it very, very uncomfortable. And it is usually misdiagnosed as bursitis, and that's what people were thinking. She had some type of inflammation going on in a bursa up here, when in fact it wasn't. It was a trigger point. And once we got figured out, I explained to her that there was this muscle up here, and we got in it, and it was quite painful, very tight. She had some other tightness going on in the hip too that we were working on, but this was the primary one that when it released, the pain really sort of dissipated. So what causes this muscle to get tight? Well, sitting, a lot of sitting. That's probably the main thing. And again, in our society, we tend to do a lot of sitting. And so this muscle tends to be tight on a lot of people. In fact, a lot of times it shows up in the tendon or the IT band by being almost really stiff and hard right down here by the knee. But again, a lot of times the muscle is tight too. So it's the opposite ends. It shows up down here, but we have tightness up here too. What are some other things that cause this? Running or jogging, that type of stuff, uphill or downhill with really improper foot support. So shoes that don't really support the feet can cause this thing to get tight. The other thing that's really common is when runners run in the neighborhood and they're running on the street, and the street is beveled. And a lot of people don't realize that your street or roads are beveled because they want the water to run off from the center off to the sides. Well, if you're running on the road, that means that you're running on this beveled, let's see, there you go, on this beveled edge, just like this. So you're running at an angle. And when you run at an angle, you're putting a great deal of stress all the way down the leg, from the ankles all the way up into the hips. But this IT band and this muscle here can get really, really tight because of that one leg is lower than the other. One leg is higher, one leg is lower when you're running on a beveled edge like that. Okay, so what do we do to take care of it once it gets tight? Well, again, I like the idea of warming things up. So taking a nice moist heat pad and placing it right here and letting this whole area warm up. So if you take a, say like a fairly decently long face towel or even a bath towel, get it moist and wet, and then put a dry one down, or even a warm one, and then put a hot one on top of it, and just lay it on there and let this whole thing warm up. That's a great start. And then once it's nice and warm, you want to take out your foam roller. Now, most people who foam roll know that the IT band can be quite tender, so be careful, be cautious. In our classes, we teach you how to work slowly into the IT band. We do that pretty much with every muscle, actually. We teach you how to work through from a basic to intermediate to advanced. But you really need to do it here, because this is, a lot of people throw away their foam rollers or stop foam rolling because this hurts so much, because it's tight, okay? So again, you're going to start nice and gentle after it's nice and warmed up, but you also want to make sure that you get up here and you work this side up here. That's really important. Most people work their IT band, but they never get up here. So make sure you're foam rolling up here. All right. I'm going to try to move Mr. Manning here. Let's see if we can do this without him coming down on top of me, because I want to show you a stretch. Okay, here we go. I'm going to back this up just a little bit here. So a good stretch for this area here, and I'm going to be going this direction. I want to put the leg that I'm moving. So if I take my leg and I put it behind, so the leg I'm bending to, since I'm stretching this way, I'm stretching this side here, I'm putting this leg behind so my right leg is going behind my left leg, and my feet are going to be side to side. So my right foot is on the outside of my left foot, all right? And then I'm just going to bend forward. I can hold on to a wall, I can bring my arm up, but I'm stretching this whole, actually I'm stretching all of this down the line. So I'm going to stretch over like that. So again, I'm standing straight. I take my right leg, I move it behind my left leg, take my arm, raise it up. I can hold on to the wall if I need to, and then I just bend forward. Okay, and you want to make sure that both of your feet, so if you're doing the right side, the left side, your right foot's going to be right next to the outside of the left foot. If I switch and go the other direction, my left foot will be right alongside the outside of my right foot. And they're both going to be pointing forward, and then I'm going to go the opposite direction. Okay? Just like that, and it'll help stretch that out. That's a really good stretch for the TFL. Okay? All right. So, a muscle that a lot of people have problems with tightness, the IT band. Oh, I'm sorry, the IT band, but there's a muscle that connects to it, and that's what we wanted to talk about today. All right? So I hope this is helpful. Again, our purpose here is to educate and to make people aware that you have the ability to take care of a lot of this tightness, the stiffness, and this body pain that you're having by simple self-care. And that's what we teach. So again, I hope this is helpful. Have a great day and take care.